Hi, Dr. Marraccini.
I'm your professional fitness coach, Roy Jeffery.
And we are Meno-Strong.
Hello, everyone, and welcome back. My name is Roy Jeffery. I am your co-host here with Dr. Linda Marraccini. Would you like to introduce yourself?
Sure, I'm Linda Marraccini. I'm a family physician. Roy and I have been doing these podcasts on a series related to perimenopause and menopause and up. And we have another one of the series today.
Absolutely. And we'll let Dr. Linda go ahead and open this up and talk a little bit about what we have in store for you today.
Okay, thanks, Roy. Well, first of all, we want to emphasize it's never too late to start. And we're talking about lifestyle changes, diet and exercise. I can't emphasize that enough. I go through that over and over again in my office. And this is with regard in this particular episode to reducing inflammation in your body. Inflammation is the basis of disease. The major diseases we're going to talk about or allude to are cardiovascular disease and cancer. So this translates to blood pressure, decrease in heart attack and stroke, dementia. We're going to talk about dementia and diabetes later, but also kidney disease. And we can talk about the best exercises to do for that, as well as make you feel better. Roy, why don't you go ahead and tell us about that?
Well, you're exactly right in what you're saying. And this is where exercise really steps in as a powerful tool, a powerful medicine. When you talk about reducing inflammation and the blood vessels, we're not just protecting our heart when we do this, we're also supporting our entire system. And blood pressure, brain health, kidney function, and blood sugar regulation is one of the things that exercise helps us with.
And really important is you have to control your destiny, control what you can control. You may have been dealt a certain set of cards genetically, but it's amazing what the studies have shown. And amazing, I've had a number of patients who we put on all these medications, and everybody thinks that doctors just give them medications, but they have been able to show me that they have been able to get off their medication by having a good diet and exercise program and be pretty disciplined. And after you get started, it's not really that hard. Also, you know, the exercise reduces inflammation as it pertains to cancer. And there's many cancers that affect all of us, but particularly perimenopause, menopause. We're talking about breast, colon, uterine, ovarian, kidney, lung, and stomach. And can you believe they would be impacted by diet and exercise? But of course, that's as it relates at least to weight reduction. And maybe Roy, you can, we talked about that midsection weight during menopause, but Roy, can you tell us more about that?
Well, when we talk about doing exercise for the inflammation, here's the best part when it comes to exercise. You don't need to start with anything intense or over intense. We mentioned this once before. Set the bar low, right? You have to set the bar low. And
the bar low.
Yeah, and you just need to be just to start smart, basically. And I can tell you, for example, I could just walk you through the most effective ways to reduce inflammation through movement, especially for women in postmenopause. First of all, you could do a brisk walk, just 30 minutes a day, 5 days a week. That's simple and it's proven. And it's a powerful way that you should be able to talk and not necessarily sing through the exercise, but you can talk through the exercise. And that's that sweet spot for heart health and inflammation reduction. Another thing you could do, which is low impact cardio. And if walking doesn't feel great on your joints or anything like that, you could try rowing, you could try swimming, you can use a recumbent bike. Those get the blood pumping and also, they're gentle on the knees and hips if you have those problems. Third, strength training. Strength training is king. This one's like a big, but you don't need to do a whole lot of resistance. You just need some resistance work. Twice a week, This can lower your visceral fat, meaning that belly fat around your organs, and this can boost your insulin sensitivity, which is very important for those who could be pre-diabetic or running into diabetes. You don't need heavy weights to start. Body exercises, bands, machines, even water bottles will help. All right, but you want to be able to have some form of resistance training, and the goal is, or I can say, the best piece of workout equipment you can bring to your regimen is consistency. You bring along consistency, and I promise you, you can't lose. One other, yoga. Yoga and breath focus movements is very good. Slow flow or restorative yoga. It all activates your rest and recovery system. So that's important as well. It helps bring down inflammation, and especially if you're carrying daily stress, is very important for you.
Well, Roy focused on two things that I wanted to emphasize. One, you're reducing your insulin resistance. So when you reduce that, it's going to help your metabolism. It's going to help your belly fat. He mentioned visceral fat. I like that. The visceral fat's a fat. You've got a whole apron that holds your intestines inside, and that gets all this fat. We also talk about fatty liver. A lot of people are getting a lot of focus on fatty liver. You can get a fatty liver, which in turn becomes cirrhosis of the liver. You get cirrhosis of the liver without even drinking. It's because of all the carbohydrates. Mm-hmm. So those exercises that Roy is referring to really can impact these things. The other thing I like that he mentioned is about you can talk, or if you can sing, but you can talk when you're walking. You are also helping the type of breathing that Roy referred to. We were talking about, I think it was episode 3 was the pelvic floor, that he talked about pelvic floor and diaphragmatic breathing. So the more you talk when you walk, you are actually helping your breathing. I'd say, well, I can't help but breathe deeply when I'm walking, but there's a different kind of breathing you do when you're talking. And you know what? Don't forget dance. Dance is, if you can dance to a video in your house, it doesn't cost you anything. You can look up a lot of stuff, and do some dancing. So any of those things, there's music is great. So music is great therapy. We are going to talk more about yoga and how great that is for you, and things like that, yoga and Pilates that are great, incorporating resistance. So for bone density, it's really important. That's a very important issue in perimenopause and menopause, and different people have different risks. Some people, depending on how much calcium storage that we all had as when we were younger, your peak bone mass is actually age 20. And then it goes downhill after that, especially if we didn't get enough calcium storage when we were younger and did enough exercise. And then as your hormones go down, you're not absorbing the calcium. And, we talk about vitamin D and some of the important things with, low hormones, you don't absorb the calcium. So the resistance exercises are important. We have to talk about when your bone density is low, we want you to exercise. You have to take care with the type of exercises you do. Roy, if you want to expand on that.
Well, look, whatever you choose to do, whether it's walking, lifting, stretching, just know that every rep, every breath matters. And it's not about being perfect. It's about being present. It's about being consistent. It's never too late to start on whatever it is. You're never too old. You're not too far gone, and you're not too out of shape. You're right on time to take back your health, one workout at a time, and that's something that we should always remember, and not to give up on ourselves. When we talk about in terms of bone density and how important that is, Dr. Linda, she's absolutely right when you're talking about protecting and improving your bone density. Exercise is not just helpful, it's essential. It's essential. Like the body was made to move. It wasn't made to not move or to be stagnant or anything like that. But we need to be intentional about what we do. Not all exercise is created equal. When it comes to bone loss, there's a major concern when it comes to that with things like, and Dr. Linda continue about women for osteopenia and osteoporosis, how low impact movement combined with guided strength training, and then put emphasis on guided strength training is the safest and most effective approach.
Yeah, and we just, different people with different bone densities. So if you have true osteoporosis, you have to be a little more careful, not be doing, high impact jumping up and down. So again, having the guidance of a trainer or getting some initial consults with a physical therapist before you just run out and do just anything. Extremes of bending for people who have osteoporosis. So that's something you have to be very careful about. But we don't want you not to exercise even with osteoporosis, because it's very helpful to have the resistance. And as we discussed, was it episode, Roy, was it episode 2? We talked about the hormones and doing the lower body has more hormone stimulation than, you have to do lower body resistance.
Right. And, let me break it down this way. First, low impact cardio, walking is excellent. If you're cleared by a doctor, a weighted vest, she spoke a little bit about that, Dr. Linda, a weighted vest, if you're cleared by a doctor, and I want to make that clear because it doesn't work for everyone. And if they have other issues, Dr. Linda, I don't, correct me if I say it having to do with the spinal cord, that it could do you more harm than good during your walks. But if you can wear a weighted vest during your walks, it lowers the spine and the hips. But here's the key: it must be done with balance and proper form. Right? Everyone doesn't walk perfectly. We all can walk, but we don't walk perfectly. So walking with good form when you're loading your spine and your hips is very important, because loading the body asymmetrically or without supervision can increase your risk of injury, and then that's kind of productive, right?
Well, Roy, and form, there you go. That's a key word. So a lot of us, start doing exercise, and I know when I'm left to my own devices and I do exercise, I get sloppy. I don't have good form. And again, that's how you hurt yourself. That's, why you should either start with a trainer or use a video, because you have to be reminded to keep your form, do your breathing correctly. And, that's how you get the most out of your exercise and avoid injury. I'm going to divert for a little bit and talk about the second part of this podcast, which is to introduce everybody to the USPSTF guidelines, which is a big mouthful, but it's the United States Preventive Services Task Force. Now you say, why do I have to know about that? Well, I think everybody needs to be educated, because that's, again, it might change right now with this administration. But since 1984, the Congress implemented a set of guidelines for preventive care. And this set of guidelines impacted everything from pediatrics to, all the way to old age, including psychiatry. So it was a group of experts were gathered together. They reviewed the literature and research that pertain to prevention. And this is where the guidelines came from that pertain to your health care. So that's how they determine how many mammograms you should get, how often you get a pap smear, how often you get a bone density. So that being said, but that is, I want to say that is carved in stone, that is written. So it may say that pretty much every woman gets a mammogram starting at age 40, unless there's some extenuating circumstances. But it can be every year. Most of the time it's agreement that it's every year, can be every 2 years, depending what the recommendations are. Interestingly, the bone density recommendation is after age 65. None of us follow that. We stop bone densities at age 50. So here's a dichotomy or a divergence of the beliefs. So the problem is that this USPSTF guideline, your insurance company looks at that. And they're going to argue with me that if I want to get a bone density starting at 50 and the average, what we do is every 2 years, they'll say, oh, USPSTF guidelines says you're not supposed to be ordering bone densities that often. They say unless a person has risk, but we tell ourselves, everybody's got risk. So, and when you come in and a patient comes in and says, well, don't I get a mammogram or don't I get a pap smear? Well, I may want to do these tests. You may want to do these tests. But if I order these tests, I'm going to have to have some good reason and jump through hoops to explain this to your insurance company. So why did they come up with these guidelines? I'll give you an example for pap smears. They determined that pap smears should be it could be every year and then after age 30, but every 3 years from 30 to 65, and then not after 65. Well, why did they make that determination? Because majority of cervical cancers, which is why we do a pap smear, majority of cervical cancers are under the age of 30, more sexually active women, etc. But, it also is based on having had adequate screening. Have you had enough pap smears all along? Remember, pap smear is just cervical cancer screening, getting the sampling from the opening of the womb. It's not doing your internal exam. It's not the assessment of your uterus or ovaries. As far as I'm concerned, as you get older, the money is at the uterus and ovaries. I have my own beliefs. I recommend pelvic ultrasounds for a lot of ladies as they get older, because I think the uterus and ovaries are very important, even more important as all of us age. Again, we can order these tests, but we have to jump through hoops and be very creative as to how we code. The whole thing's about these codes we got to do for insurance. You as patients can have control over what you want, but you have to have a little understanding of the fact that we as healthcare providers have to be very creative what we're putting down. But you also need to understand the reason they made these recommendations is they base it on probability. But of course, just because a majority of women who have cervical cancer are under the age of 30 doesn't mean you can't have cervical cancer when you're older. So it's a big conversation that you have to drive to your healthcare provider and make yourself understood in what you want. So it doesn't mean you can't have these tests just because they say these are not the guidelines. So I get in that conversation every day. The mammogram, the pap smear is more cloudy. The mammogram, pretty much everybody's ordering mammograms, but it's interesting. All the medical societies don't agree. The American Cancer Society says one thing, the Society of OBGYN says another thing. So it's very interesting that they don't agree. And yet we have this USPS, guidelines that have this dictate. So it's very interesting. And then, they tell your insurance company says that, oh, we're going to take the least expensive way to go. Mm-hmm. So, it's very important that you make this decision with your healthcare provider. And this is what you can say. How can I get this test done and get it covered by my insurance? So that's the game I'm going to tell you that we have to do to get your healthcare. It's not fair. I'm sorry. And I'll give you another example. We'll talk about it later, but colonoscopy. The age for colon cancer has dropped in the United States to 45, probably because of the way we eat and processed foods and everything. So they dropped colon cancer screening, but they made that if you have a normal colonoscopy, you don't get another colonoscopy for 10 years. I'm not comfortable with that amount of time of no cancer screening. So these are all things, to have an individual conversation. What can you also do? Modify your diet and your, exercise. So the next thing I want to talk about, the diabetes, for example, everybody wants to get screened. Theoretically, we're not supposed to screen you, but at least once a year, even less than that, unless you have a big family history. We don't do that in practice, practically speaking. But I want to refer to the diabetes as a segue for Roy to discuss how diabetes is like one of the number one things that you can influence as it impacts dementia. And dementia can be impacted by the amount of exercise you do. Even They showed even when you start exercising in your 80s. So once again, Roy, maybe you can comment on this.
When you talk about dementia, I think that it's one of the things that are kind of overlooked until someone says something, and it is like an alarm that goes off for whatever reason. But it's something that's very important to cover and to go over. I would assume it as your physician, and it is with your physician, not necessarily when it comes to me. But if I know a person is, and I'll say aged, that there are certain things that they can do that will help them when it comes to having come across possible dementia or early stages of it. And one of the things definitely is being exercise is very important. And I know all I talk about is exercise, but that's the key. I mean, it's to good health. And the exercise plays a powerful role in preventing the cognitive decline and dementia, because the truth is that what's going on for your heart is often just as good for your brain as well. Meaning the exercise, you get the increased blood flow to the brain, just like you would get it to the heart. You would get that delivery of more oxygen, more nutrients, and it helps clear away metabolic waste, including plaque that's linked to Alzheimer's disease and things like that. So what type of exercise are we say that are most protective of the brain? It's a good question. And there will be aerobic exercises where we talked about the walking, the cycling, the swimming, the dancing. All of those improve cardiovascular fitness. And our research has shown that 150 minutes of moderate aerobic activity per week can reduce dementia risk by 30%. Now, the key benefit is to boost memory. It improves attention, and it supports brain volume. And there are things like I've had older clients that I have trained, and we've done things like this thing called Blaze Pod, something like that, where it lights up in different sinks, and they have to touch the light every time it moves around. But that helps with improve the brain function. And of course, strength training, the mind body muscle work. When you lift weights, you use resistance bands, you challenge your brain and your body to work together. Strength training improves the insulin. Strength training helps reduce the inflammation, as we've already covered, and even enhances the executive function, like planning, decision making, and things like that. And so, doing things that are skill based and learning, focused movement. Here's where it all gets interesting. That activities require focus, like dancing. If you're doing dancing moves, or you're learning a new dance style, the coordination, the learning activity brain regions, they're responsible for memory and attention. These are the things that help you to fight off dementia. So that's all a part of activity, all a part of movement. And Dr. Linda is more of the expert when it comes to the medical parts of that. But just different exercises. There's so many exercises. Martial arts is a different thing. Tai Chi, guided Pilates sessions, boxing, pickleball, whatever it is. Those things will help with that movement, hand-eye coordination, stuff like that. It makes your brain work in other ways. And again, it's not, start, the bar low. When I say that, that is I can't make it any easier than that. People think that, well, that's not enough, so I'm not going to do anything at all. That is far from the truth.
Well, Roy mentioned Tai Chi. Now, I was amazed. I was in Asia and I saw throngs of people in a park doing Tai Chi, all older people. But Tai Chi is wonderful. It's very deliberate, movement. And it's also, the other thing is they're follow the leader. They're following somebody. So it's also been shown that when you follow somebody, and again, you're tracking. So your brain has to tell your arms and legs what to do, whether you're taking a class, following a trainer, following a video. That tracking has been proven to form new neurologic pathways, even in an 80-year-old brain. So that's crazy in my mind. I just can't believe that you can do anything with your brain, as far as new neurologic pathways. Mm-hmm. But it's been shown that when you do that hand-eye coordination, that your brain has to tell your arms and legs what to do. When you're following, you have to track. Mm-hmm. So that, and then they also said ping pong is also a very good brain activity, playing ping pong, that kind of. It doesn't take a lot of movement for ping pong, but it, apparently helps dementia, as far as, brain function. So, pretty much these are, if we haven't said it like 100 times, you got to get out there and do something small. And we're going to circle back and get into some of the other health maintenance recommendations. There's a lot of those. I've only touched on a few. And of course, we're going to continue to emphasize diet and exercise. We have more guests, we have guests that will talk about diet and yoga and other things like bioidentical hormones. So we have other things we're going to allude to and have on the podcast. So stay tuned.
All right. So thank you. And we're very grateful for all the comments, the follows. Please share our podcast with others. Someone who may be going through the same things that you're going through or experiencing. Share it with men as well, because we'll be talking about men and their pelvic floor problems, or our pelvic floor problems, because that's very important as well. And we'll have a pelvic floor specialist on some of these. So continue to follow us so that you don't miss anything. You'll be the first to get it right away. And one other thing, don't forget to follow us on YouTube. That's very important. We want to get as many subscribers, as it is said, as possible, because we want to be able to spread the word. We want to be able to benefit our cause to the MenoStrong program. So I myself, Roy Jeffery, fitness professional, and Dr. Linda, we say goodbye for now, and we'll see you soon. All right? Thank you.
We really appreciate you listening to our podcast. Do us a really big favor and share this podcast with others. And you can do us a really big favor by being a follower. Follow our podcast, subscribe. Thank you so much. Until next time.